Welcome to Before It Breaks. We focus on prevention, early detection, and practical lifestyle changes before crisis strikes. Heart disease doesn't usually happen suddenly. It develops quietly over time. And most of the time, it starts with risk factors we ignore every single day. But here's the important part. Many of the risk factors are preventable. Let's talk about the risk factors, those things that increase your chances of developing heart disease. They fall into two main categories: non-modifiable, which you cannot change, and modifiable, which you can control. Let's talk about the non-modifiable risk factors: age, family history, and gender. These are important to understand. As we get older, our blood vessels are no longer as soft and stretchy as they used to be. They become harder with time. Because of this, the chance of heart problems becomes higher after 40 years of age, and even higher after 60. If your parents or siblings had heart disease, especially at a young age, your risk is higher. Men tend to develop heart disease earlier. After menopause, women's risk increases significantly. You cannot change these factors, but knowing them helps you act earlier. Let's discuss the modifiable risk factors. These are the ones we can prevent, control, or reverse. High blood pressure, often called the silent killer, damages blood vessels and increases the risk of heart attack and stroke. High cholesterol, or dyslipidemia. Too much bad cholesterol leads to plaque buildup inside arteries. Smoking damages blood vessels, reduces oxygen supply, and increases clot formation. Diabetes can lead to high blood sugar, which damages blood vessels over time. This can cause serious health complications. When you don't move your body often and sit for long hours, your heart becomes weaker, and you are more likely to gain weight. When someone has too much body fat, especially around the stomach, it makes the heart work harder than it should. Eating too much salt, too much sugar, fried foods, and processed foods can increase your risk of heart problems. Being stressed all the time can make your blood pressure go up and harm your heart. These problems don't just add together, they make each other worse. For example, having high blood pressure is risky, but if you also have diabetes and extra weight, your risk becomes much bigger. Here's the good news. You have the power to protect your heart. Check your blood pressure often. Know your cholesterol and blood sugar numbers. Move your body for at least 30 minutes on most days. Cut down on salt and packaged food. Keep a healthy body weight. Avoid smoking. Find healthy ways to handle stress. Remember, small healthy habits done every day can keep your heart strong for many years. Heart disease may be common, but it doesn't have to be your story. When you understand the risks, you give yourself a chance to change the outcome. Take one small step today. Keep going tomorrow. Your heart is worth it. If you have concerns about your health, speak to your doctor. Please protect your heart before it breaks. See you next episode. Bye.